Mike from RunPhys.com. Thank you for watching today's video. Please consider subscribing to the blog if you have not already. That way you won't miss any of these videos that can help you in your journey to becoming a better runner. Today's video is on the topic of sacroiliac joint pain. Now the sacroiliac, or the SI joint, is the joint where your tailbone meets up with the rest of your pelvis. It's a common area of aggravation and kind of crankiness and soreness that's common to runners as well as to people in everyday life. Now when it comes to the SI joint, what happens there is your tailbone meets up with your pelvis, and your tailbone, since you only have one of them, you don't have a right and a left side, that tailbone with every step that you take is going to rotate side to side as well as flex forward and backward and side bend. So it's going through a multiplanar movement with every step that you take. And what can happen is one side can get stuck or can get tight muscles around it, which can cause that side to move differently, which can then lead to the other side not moving as gracefully as it should as well. And what we feel then is pain right in the edge of our tailbone, or it often feels like it's deep in our glutes as well. Now quite often the side that's painful is the side that's moving too much, because the other side is not moving enough. It's very common to see that the painful side is not the one that needs to really be targeted. So what I want to show you today are 3 exercises that you can do to address any sacroiliac joint crankiness that you may be experiencing. The first one is a self-massage technique. We're going to target the piriformis muscle as well as the glutes, which are the muscles right around the sacroiliac joint. So you get down on the floor and using the very edge of a foam roller or some type of a firm ball, you're going to place that right on the edge of the musculature just to the side of the bony part of your tailbone. If you're right on the bone, then that's going to be no good. That's going to hurt you. But if you're just onto the musculature to the side, that's right where you want to be. And you want to roll around for 2 to 3 minutes, targeting the most noticeably tight spots and just going back and forth in a very small amplitude. Again, for 2 to 3 minutes until you feel that area loosen up. The second exercise you're going to do is a stretch we're going to call the wall chair stretch. So this takes a little bit of setup to do, but if you can do it, it's going to target many muscles as well as help get the joints translating like they should. So what you'll do is you'll place a chair or a stool or something else near a wall. You're going to put the foot nearest the wall up onto that chair and put both your hands against the wall. In that position, you're going to then gently slide your hips towards the wall, feeling a good stretch in the glutes, and hopefully a little bit of the sensation of knocking rust off of the sacroiliac joints. In essence, trying to make those joints move a little more freely. And you're going to do that about 30 times, and you're going to want to do that both directions. Even if it feels like you're having pain mostly on one side, what you may find is that when you do the other side, when you stretch the other side, that side actually doesn't move as well, in which case that's a dead giveaway that the painful side is not the problematic side. So you want to make sure you're targeting both and trying to figure out where your specific deficit lies. Lastly, we're going to do an exercise to help strengthen up the muscles that should be properly supporting your sacroiliac joints. So what you'll do is, if you have some TheraBand, you're going to wrap that around one of your feet, and we're going to do some single leg deadlifts in that position. What you're going to do is, if you wrap it around your left foot, you're going to reach with your right hand and grab onto that TheraBand. You can do 15 deadlifts, except for we're going to be bending your knee, so it's not a true deadlift. You can do that 15 times with your right hand and then 15 times with your left hand. You're going to switch to the other foot, do 15 with each hand on that foot as well. What that exercise does again is it helps to strengthen up all the muscles that should be supporting your sacroiliac joints. Now if you do all those things, as far as get it moving better, get the muscles more happy, get the joints moving more happily, and then stabilize those muscles, that should make you a more smooth, symmetrical, and efficient runner, as well as decrease any aches and pains that you're having. So give those a try. Please give me feedback on how those go for you, as well as if there are other topics you'd like me to address in these videos. Otherwise, have fun, run fast, friends.